I'm going to demonstrate to you how to draw up a sub-Q injection. For today's demonstration, we're going to use insulin. There are other reasons, though, you might need to use a sub-Q injection, and that would be for anticoagulants. Okay, so I'm in the mid room. I'm going to wash my hands, and I have my MAR here, and my patient has a blood sugar that was done earlier, an Accu-Chek, and it was 240. So I'm going to look at my sliding scale chart on my MAR, and I see that I need to give 4 units of regular insulin. So that's what I have. Okay, and I have an alcohol wipe, and I have my insulin syringe. Okay, so I'm going to go ahead and clean off that top. Opening up my syringe. I have a garbage can here. Okay, I'm going to inject the amount of air, same as the amount of fluid I'm going to remove. So I'm going to pull my plunger down to 4, remembering that the inside of the plunger is sterile and the needle is sterile. Okay, I'm going to push that air in. Now I'm going to flip my vial over. I'm going to pull that a little bit past 4. Give it a couple flicks there for any bubbles, and push it back up to my dose of 4. Okay. Some medications will require a second nurse to check the dose, and insulin is one of those. So let me recap here, and then I'm going to have another nurse tell me the dose of insulin in my syringe to make sure I'm correct. Okay, so I'm going to go ahead and do my second check. The sugar was 240, so I'm going to give 4 units of regular. That's what I have. Good. Okay, I'm going to go ahead into my patient's room. Sometimes with multi-dose vials as such, if your facility requires that you scan it, you will take into the room a certain label for that. Today I'm going to take my vial with me. Good morning, Miss Cross. I have some medication for you. Okay, I'm going to provide for privacy. Wash my hands. Grab my MAR. Miss Cross, can you tell me your full name, please? And can you tell me your date of birth? Good. And any allergies? No allergies? Okay, thank you. I'm going to do my third check. Regular insulin, 4 units. Okay. The site for today that I'm going to use for Miss Cross is her abdomen. There's 3 possibilities for your subcutaneous sites. We could do the arm, and the landmarks for the arm would be to put the palm of my hand below the acromion process, and the other hand, the palm of my hand in the acromion process, and the other hand above the elbow, and it would be that area in between. The other site, which I'll use today, would be the abdomen, and I would locate the umbilicus or the belly button and just make sure I stay an inch away. And then the other site could be your patient's leg. And for that site, I'm going to put a hand below the greater trochanter and a hand above the knee, and I would go right on top of the thigh. Okay. For our demonstration today, we'll use the pad up here on the table. Okay, Miss Cross, I'm going to clean your skin with some alcohol. It's a little cool. For sub-Q, I'm going to pinch up. I have my syringe. I'm going to hold that again like a dart. I'm going to go straight in. I'm going to push down. Slowly let go of my squeeze. I'm going to hold that syringe in for a couple seconds to let the medication absorb. Pull that straight out. Activate my safety. Quick little wipe. Put that in the red box. Okay, Mrs. Cross, I'm all done with that injection. And take off your gloves. Wash your hands. And that concludes our demonstration for sub-Q.